All right, Washington, I am here in the beautiful Mount Rainier National Park, and I am on the Wonderland Trail. I'm going to give you a quick view here. It's absolutely beautiful, absolutely peaceful and quiet. You just hear the sounds of nature. You're not here for that. You are here to understand how Medicare works in Washington. So let's talk about it. And we're going to start with Medicare supplement plans because Washington, you are very unique when it comes to supplement plans, more unique than almost every other state in the country. So your average cost for a Medicare supplement plan G here in Washington is $210 per person per month. The national average is $150 per person per month. For a plan N, your average cost here is $185 per person per month. Nationally, the average is $120 per person per month. So you see a considerable bump or a difference in your costs versus the national average, and there are two main reasons for this. The first reason is because Washington is a true community-rated state. Remember, there are three ways that supplement plans can be written or rated. The first is attained age. This is based on the age that you have attained. You would get bumps on your birthday, and every year you could also see another bump that insurance companies do for rising healthcare costs and inflation. So potentially 2 bumps a year with attained age plans. The other option is an issue age plan. This is based on the day that you were issued your plan. So if I go on at 65, I get a 65-year-old rate. If I go on at 75, I get a 75-year-old rate, but I'm not getting the happy birthday bump every year for my birthday increases. So at 75, I'm not getting a bump because I'm 76. I'm not getting a bump because I'm 77. Now, a mistake that people make with issue age plans is they think, oh, I'm not going to get any increases if I get an issue age plans. That's not the case. You're just getting that one annual increase for rising healthcare costs and inflation. You're not getting it because of your birthday. But neither of those apply here in Washington. Yours is community rated. And what that means is that everybody is paying that same cost. Whether you're a 65-year-old or you're 105 years old, you're paying the same rate. What this means is that those who are going on to Medicare, the younger you are on Medicare, so at 65, you're paying higher than normal. But the longer you live, the more that normalizes, and you're actually paying less than you would otherwise. So for an 85-year-old or 90-year-old, you're paying considerably less than you would for 85 or 95-year-olds on an attained age plan, as an example. So that's reason number one, why your supplement plans are higher than the national average. Now, reason number two is because you have a very special switching rule when it comes to your supplement plan. In most states, you can't just switch from one supplement plan to another without medical underwriting, without the fear of getting denied, without answering medical questions. Here in Washington, you can. Now, there are two things to mention with that. So if you are on a plan A, you can only switch to a plan A with another insurance company. Now, you can apply to any of those other letters, but you would have to go through Medicare underwriting. Now, the second part of that is if you are on a plan B through plan N, you can switch whenever and wherever you want between supplement plans. If you're on a plan N and you want to go up to a plan G, you can, which is very rare. You can't do that in most states throughout the country. You can go from like or lower plan, but here you can switch up to a plan G. You can go from a plan G down to a B or a K and then back up again. Now, I wouldn't recommend that you're bouncing all over the place with supplement plans, but you can, and that freedom and flexibility costs you in the form of higher rates. Now, you must be covered by a supplement plan to switch to a supplement plan, and you cannot have a lapse in coverage for more than 90 days. So that's the big thing to watch here. Make sure your supplement plan coverage does not lapse for 90 days or more. Otherwise, you don't get that freedom and flexibility to switch around. And again, this is only from a supplement plan. You're starting on a supplement plan and you're switching to a supplement plan. This is not the same if you're on an Advantage plan and you're switching or wanting to switch back to original Medicare and a supplement plan. Those you have the normal trial rates that you have nationally. There's nothing special about those rates here in Washington. And we're going to cover that here in a minute. Now, a metric that we look at is called the market penetration rate for supplement plans. And what that means is that if 100 people are given the option to choose a supplement plan or an Advantage plan or FEHB, TRICARE for Life, VA benefits, original Medicare only, how many of them are choosing a supplement plan? And here in Washington, the percentage is 21%. That is exactly in line with the national average, which is 21%. So you're right around average here in terms of how many people are choosing those supplement plans. The costs, I think, contribute to that, but then also the flexibility to switch around also contributes to that. And that's all supplement plan letters combined make up that 21% number. If you're looking for a supplement here, there are opportunities for discounts. To, again, that average number that I gave you, there are plans that are lower and there are plans that are higher, but there are opportunities for discounts here. So an example is if you have somebody living in your house who is on the same insurance company as your supplement plan, they give you a household discount. There are discounts if you wear a smartwatch or a fitness tracker of some sort and you can connect it to the insurance company's website and they can see that you're active, like you're going on hikes as an example. There are discounts available if you pay your premiums all up front in a year, so annual premium payments rather than monthly premium payments. you would get a discount for that. So even though your premiums are a little bit higher here in Washington, there are opportunities to get that back to closer to normal if you're working with the right opportunities and the people to find those plans for you. Here's a break in the action again. So when we're talking about supplement plans and people who are pre-65, so again, you're qualifying because of a disability, because of ALS, because of ESRD. In a lot of states, you don't have a lot of protections. In some, you can't really find a supplement plan. In others, sure, you can find a supplement plan, but they're insanely expensive. Some of them only offer Plan A, and you're looking at like $300, $400, $500, $600 a month just to get these plans. And so some states have more protection around that for pre-65. Now, Washington, you're kind of middle of the road here. You do have plans available for pre-65. They aren't insanely expensive or anything crazy, but you do have that option, which is nice and which is different than other states. So the fact that you are able to get supplement plans is good. You are going to pay for them, but not quite as high as some other states where there's just zero protections and they just skyrocket those prices for the supplement plans when you are on Medicare pre-65. And once you turn 65, you have that initial enrollment period for supplement plans, or the supplement plan open enrollment period, or the supplement plan enrollment period, however you want to call that, where you can jump on a supplement plan without medical underwriting, should you take something like an Advantage plan pre-65 if that's available to you. Okay, now let's switch over to the Advantage plan side. And before I do need to mention a very special partner that has gotten this all for us. Again, we told them we wanted to come to Mount Rainier. They got us a place in Ashford that is absolutely adorable, and I'm going to do a review of where we are staying over on our other family channel. But ET Family Travel set up all of these stops along the 48-state road trip, and this is one of them that is just so awesome. It's so beautiful, so amazing, and we have 7 people on this part of the trip. I've got my 2 in-laws, I've got my 3 kids, and I've got me and my wife. And so to find a place that can house 7 people comfortably with everything that we need in terms of the things that we're interested in, our kids are interested in, and then my wife's parents. Unbelievable job. If you're traveling anywhere in the US, but also anywhere internationally, ET Family Travel is absolutely incredible. There's a link to them in the description of this video if you were planning a trip. They specialize in Disney, which is coming up here on our trip in a few days. All right, let's talk about Advantage plans here. Here in Washington, you have a lot of good competition when it comes to Advantage plans, meaning you have a lot of insurance companies with a lot of plans, and that competition benefits you. You get better benefits if there are more companies participating. Now, let's talk about that for a minute, because in Washington, and this is true with all states, there are areas that are a little bit more rural. So you have fewer people living in those areas. The case is the same here in Washington as everywhere else. In more rural areas, Advantage plans have a harder time competing because fewer insurance companies want to be in the more rural areas, and getting contracts and negotiations with hospitals in a more rural setting is much more difficult and much more expensive. So rural Washington, Advantage plans are either not going to exist, there are places that do not have Advantage plans, or the Advantage plans aren't going to be as competitive as they would in more urban areas. So let's talk about the urban area Advantage plans. Very competitive, very strong networks here in Washington, and you have Kaiser to deal with. So Kaiser, we're going to run into them here in Washington, Oregon, California, but Kaiser is an integrated hospital system. They do not work with independent agents like us. So if you wanted to reach out to us and compare all of the other insurance companies, but then go to Kaiser, you have to work with a Kaiser employee to get Kaiser. So I'm going to take a step back here. We have a lot of agents who watch our videos, but this is specifically for beneficiaries of Medicare. The feedback that we get about Kaiser is either people absolutely love them or they hate them. And it's weird because we just don't hear a lot of in between of just they're indifferent or it's okay. It's one or the other, very polarized. And the reason is the exact same for both. It's just how people handle that reasoning. With Kaiser being an integrated health system, that means that the hospitals, the doctors, the nurses, the administrators, they're all coordinated together and working together with the plan as well. What that means is, and this is in the data, Kaiser has lower denials of prior authorization requests, almost the lowest in the entire country, because again, doctors, administrators, as they're submitting a prior authorization request, they know what will get through and what won't. So in that case, it's really good. However, because it is an integrated system, they kind of handcuff you to that system. So you can't go around and try other doctors outside of their system. You don't have a lot of freedom and flexibility to go outside of Kaiser. And if there is a rule or a system in place that you don't agree with, you're stuck in that system. So if you absolutely love Kaiser, go to Kaiser, look at those plans, see what they offer, and if it would work for you. If you don't like Kaiser, work with an independent agent who can compare the different plans for you, whether that's Advantage plans or supplement plans, which again, this isn't a big promotion for us, but I do have partners who are licensed and familiar with the plans here in Washington. If you are in Washington and you're looking for help around choosing Medicare plans, don't hesitate to reach out. My email is in the description of this video and I will connect you with my partners. I had completely finished the recording and then realized that I forgot to mention the average maximum out of pockets for Advantage plans. So I'm inserting this here now as I'm walking back down the trail. We'll get back to the regular video here in a minute, but the national average for maximum out of pockets when it comes to Advantage plans is $5,000 for the year. Here in Washington, it is the average, which is probably why I forgot about it. It's just very average, standard, $5,000-ish. Again, there are plans that are higher than that. There are plans that are lower than that, but that is your average. Going back to the competition with the more urban settings, that's where you're gonna find a little bit more competitive rates there. Back to the regular video. Okay, let's talk about that market penetration rate when we have Advantage plans. Remember, that's if 100 people are offered all of these options, supplement plans, Advantage, FEHB, VA, TRICARE for Life, or others. How many of them are choosing an Advantage plan? The national average is 50%. Here in Washington, it's 46%. So a little bit below average here from the Advantage plan perspective. A lower than average Advantage plan rate and a at average supplement plan rate that doesn't add up to 100%, that means you have more people here that are choosing FEHB, VA, TRICARE for Life, or they're dual eligible for Medicare, Medicaid, or they're just doing original Medicare only. Have people hiking around. Now, my favorite comedian of all time, and this is the keyword, is Nate Bargatze. So he has a joke where he comes to Mount Rainier. Part of the joke revolves around a horse, and I'm hoping that we see that horse as we move on here. But we are headed off to Oregon next. Washington, you've been amazing, absolutely beautiful, and thank you for making it this far.